Hello everyone. So today's lecture will just be a short tutorial on how to analyze an X-ray and how to present it during a Viva. So in today's video we'll be mainly dealing with the upper limb X-rays and the thorax X-rays. So when we're coming to this particular X-ray that I've taken here and as an example for you guys, we have an X-ray of the shoulder joint mainly. So when we talk about an X-ray, the major things that we have to mention are the following. First of all, we have to say that what type of an X-ray it is, the view that we are seeing in the X-ray. So in this case, in this X-ray, it is an AP view that we are seeing. When we come to the upper limb, always the X-rays are in AP view. We do not see any other kind of view. Usually it is an AP view X-rays that we'll be seeing, or sometimes if it's of an elbow you could see the lateral view X-rays also. Before talking about the view, you also have to talk about another important thing, if it's a plane or a contrast X-ray. So if the X-ray is a plane type or a contrast X-ray. But in the case of the upper limb, usually we don't have any contrast X-rays. It's usually just the plain X-rays that we're going to be looking at. So first we talked about that this is a plain X-ray, and then we came to the view in this case, which was the AP view. Then we talk about the bones which are present in this X-ray. So now coming to the bones, the major bones present in this X-ray are the scapula. As you can see here, I've outlined it with the acromion process, and your coracoid process is also seen over here. And then you have the humerus, the head of the humerus mainly, which is articulating with the glenoid cavity of our scapula. Then we have another bone, which is your clavicle, as you can see here. So you have to talk about the bones. After you talk about the bones, the next important thing is the joints that you can see in this particular X-ray. So for this particular X-ray, you can see the major joint, which is your shoulder joint right here, where you have the head of the humerus articulating with the glenoid cavity. And this joint is a diarthrosis, and it is a ball and socket type of joint. Then another joint that you can see here is the acromioclavicular joint, between the acromion and the clavicular process, which is just a plain simple joint. Then another thing you have to say is if any epiphyses are seen. So for the radiograph that I have taken here, no epiphyses are seen. So when we are saying a summary of this X-ray, this is a plain X-ray in the AP view, which is showing the shoulder joint mainly. The bones that are seen in this X-ray are your scapula with the acromion and the coracoid process, the head of the humerus articulating with the glenoid cavity, and the clavicle. The major joints seen in this case are your shoulder joint and the acromioclavicular joint. And the epiphyses, there are no epiphyses in this case. So I hope you have understood how to explain a radiograph simply, and I hope this video was useful. Thank you.